Cs-Sunn came up as a result of the need to scale up nutrition in Nigeria. And it is also a response to the UN call for countries to sign up on the scaling up nutrition movement. It's a movement, so it's not an organization. So people are free to join and people are free to drop. But as a responsible society, as a responsible voice for the civil society organizations in Nigeria, the Cs-Sunn saw it, the need, and a couple of organizations came together around 2012, if I'm not mistaken, to establish what we now refer to as Cs-Sunn in Nigeria.
Our vision is to see a country where every citizen, irrespective of where you are, irrespective of your age, irrespective of your status, has food, and not only has food, but is also nutrition secured.
So if we are going to get to that level, we can't do, a once and for all intervention and leave it at that. We have to keep engaging until we get to that level where, at least every household in Nigeria can be proud of having food on its table, even if it's not 3 square meals. Even if it's 2, but let the food be, nutritious enough so that the children in the home, even the adults, can have proper growth.
Cs-Sunn have come a long way. We came into this field of nutrition advocacy about 5 years ago. And as at the time we came, sometime in 2014, I would say, there were key players in the field, but there were areas that needed the influence of a civil society that will have, that has the kind of spread we have.
Cs-Sunn at the national level is a coordinating body that has tried and done a lot to ensure that there are state chapters where the work really is. The state chapters are actually the ones that are supposed to have face-to-face meetings with the state governments, with communities, with other actors as far as nutrition is concerned. And what Cs-Sunn has been doing is to build capacity of its members and also the state actors, that's government functionaries, to not only understand what the issues are, but to also know what to do in order to take care of the issues.
We want to continue to be the organization that is leading in budget advocacy, holding governments to accountable, analyzing budgets, providing information to government and to CSOs and to the general public as to what we think about what government has appropriated and what should be appropriated for health and nutrition. We also want to be the go-to organization in the area of capacity building for all issues that has to do with nutrition.
Cs-Sunn has worked both with us and behind the scene to ensure increased funding for nutrition. Cs-Sunn has also worked towards mobilizing civil societies for nutrition. So when you see the impact that Cs-Sunn has made at the national level, you will want to replicate that at the subnational level.
Lagos State now has a Lagos State policy on food and nutrition and a multi-sectoral plan of action on food and nutrition. In Lagos State initially, there was no definite budget for nutrition. And of course, there was no policy on ground for nutrition. Yes.
For national policy on food and nutrition, well, it's something that we've been working on for a couple of years now, and we are all aware of it, especially in the Ministry of Health initially. But as of recent, last year, about 2 years ago, we had our own state policy draft, that is Lagos State Policy on Food and Nutrition as a draft, and the multi-sectoral plan of action too. Since 2016, Cs-Sunn has been working with us. They've been able to do so many things, activities, which include, giving us the support, pressurizing the ministry to see that I mentioned something that we created, budget line, nutrition budget line, is as a result of coming to tell us the reason why we need to do that. Not only that, Cs-Sunn has actually given so much support, so much help to us, and Lagos State appreciates that effort.
PACFA project started in Niger State, I think around 2016 to 2017 or thereabout. The project was meant to carry out advocacy for improved budget allocation for nutrition in Niger State, where stakeholders were engaged, especially the policymakers and the legislators. And I think at the end of the day, during that PACFA project, we were able to secure nutrition budget lines. We secured budget lines for nutrition in the Ministry of Health. Before that time, there was no budget line for nutrition in the state.
I think the major issue is continuous advocacy. The major issue is continuous advocacy. And like I said, we're looking at ways of expanding the targeted audience. Yes, members of the State Assembly, members of the State Executive Council, but gradually there should be expansion to other key stakeholders so that it will really go down to the society generally. It's not all about budgetary provision alone. It's not all about budgetary releases alone, but it is all about enforcement and ensuring that it reaches down to the grassroots where we're supposed to have, the outcome and feel the impact of what we are doing. Honestly, Cs-Sunn has done a lot. Given, the successes achieved so far, where we have reached and where we're coming from, we must give commendations to Cs-Sunn for what has been achieved.
The activities of Cs-Sunn in my state has changed the narratives in nutrition implementation for better. But then, like an Oliver twist, I also want more. I'm not saying the way I'm saying it that we don't still have other challenges. I still want them to be there for us to push it, and so that one day we can beat our chest and say, yes, we've arrived.
I think we still need to collaborate a lot with Cs-Sunn, because collaborating in the sense that the issue of the advocacy, the method they brought, we need to go further in that. And we also have to know that the issue of nutrition is not just for Ministry of Health. We cannot continue to work in silo and think we are going to achieve it. We have to work in group. It should be a multi-sectorial thing. And that is one great thing that I think if we continue like this, it will be easier for us to achieve our targets as a state.
Nasarawa State has recorded a lot of improvement. These improvements might not yet be in terms of the indices, like I said, but there are background changes that are taking place. And to me, it's exciting because if it is sustained, I am very sure that in a very short while, we're going to see changes in those indices. For example, before Cs-Sunn's intervention, most MDAs didn't have budget line for nutrition. And where there is no budget line for nutrition, you don't expect money to be released in that direction. But because of advocacy efforts through Cs-Sunn, now all MDAs have budget line for nutrition. That is a positive step.
I want to appreciate Cs-Sunn for organizing retreats, meetings of stakeholders and relevant line ministries in charge of nutrition activities in Nasarawa State. Without contradiction, I want to say that Cs-Sunn has impacted a lot of knowledge on so many of us, a lot of stakeholders. For me, I have attended, this is almost the fourth time I'm attending this kind of meeting. It has impacted a lot of knowledge on so many people, so many stakeholders in the state, and that has also gone a long way to expand the scope of nutrition activities in the state, and by extension, it has also imparted on our ability to increase the size of our budget to take care of nutrition activities in the state.
The policy on food and nutrition is actually a document we have worked on, I think almost 3 years back. We have tried as much as possible to use it within the confines of the State Committee on Food and Nutrition. Then we have the strategic plan of action, which is, I think, very popular now because basically all the line MDAs in the state are utilizing it for implementation of the activities. I think it's one of the items that we have deliberated in this retreat and brought it to light even among the legislators from our state.
Honestly, from the initiation of Cs-Sunn in Kano State, we have gone a lot of series of capacity building. Cs-Sunn has given us a lot of capacity building in the area of advocacy, how to develop messages for advocacy, how leadership is, and then how we can monitor and track budget, and how we can influence stakeholders to budget for nutrition. Projects has yielded a lot of success stories. Before, we are not having access to budget tracking and to even say something about budget. But with the coming of Cs-Sunn and PINS project, we are able to be included in the State Committee of Food and Nutrition, and then budget tracking, and then make sure that the budget was, nutrition budget was included.
Cs-Sunn has been very helpful and a good partner in promoting nutrition in Kano State. As I'm talking to you, it was the Cs-Sunn that facilitated the coming up of nutrition policy in Kano State, as well as multi-sectoral plan of action. Kano State has a nutrition policy in place and multi-sectoral plan of action that was duly approved by the Kano State Executive Council.
Since the commencement of Cs-Sunn in Kano in the year 2015, we really appreciate all their support. in terms of high-level advocacy to our policy makers at any level. So they are supporting us in terms of this issue of Kano State nutrition policy. They are the ones to support all the process from the beginning of the development of policy up to the end of the policy. They are now going to support the printing of all the necessary documents for the policy so as to share during the domestication of the policy by the executive governor of Kano State. So we really appreciate.
The Partnership for Child and Family Health, that is the PACFA project. Yes, that happened sometime in 2015 to 2017. And Kaduna State was one of the states that was privileged to be part of that implementation. It was an implementation that happened amongst, with 8 civil society organizations, of which Cs-Sunn was also part of it. For example, budgetary allocation. Recently in the 2019 budget, we were able to advocate and we had an increase of about 500 million allocation for nutrition in Kaduna State. As at the last budget for 2020, jointly again in our advocacy as partners working together on nutrition, we were able to also secure another 300 million allocation for nutrition in the state. So partnership and advocacy is working very, very well as a strategic focus for Cs-Sunn.
Cs-Sunn has done quite a lot of work. They have done great in supporting Kaduna State to advocate for creation of budget lines, not just budget line, but adequate budget line that will handle the issues of malnutrition in Kaduna State.
A lot has changed due to this increased intervention. Some of the key outcomes of nutrition has improved over these years. There is an increase in budget allocations, budget release, and we have seen manifestation of a decrease in stunting rates, as well as the wasting and severe acute malnutrition has also dropped in the state.
And what we were trying to do is to organize states, civil society organizations in those states to know, to build their capacity to be able to advocate for what we stand for in their various states and so on. And then we were very lucky to have the PACFA project funded by Bill and Melinda Gates Foundation.